And staying with news from the United States, top Republicans in the U.S. are now hitting out at New York Governor Andrew Cuomo for undercounting COVID deaths at New York nursing homes. Last month, Cuomo's administration confirmed that thousands more nursing home residents died of the virus than the state's official tally. For months, the state downplayed the true numbers. After several reports, at least 12,743 long-term care residents are said to have died of the virus, which is far greater than the official tally of 8,677. The surprise development comes after a report by the state attorney general found that the death count could be 50% less. That means the true death toll of New York nursing home residents is around 13,000 people. According to new records obtained by the Associated Press, more than 9,000 recovering virus patients in New York were released from hospitals into nursing homes at the height of the pandemic. This was done under a controversial order by Cuomo last year. Andrew Cuomo's March 25th directive required nursing homes to take recovering COVID-19 patients. It intended to free up space in hospitals swamped in the early days of the pandemic, and the directive was scrapped amidst criticism that outbreaks were accelerated due to the same. Now, Cuomo reversed the directive on May 10th, barring nursing homes from accepting COVID-19 patients without a negative test first. This raises new questions as to whether Andrew Cuomo's directive helps spread sickness and death among residents. But his administration disputes the charge. Critics suggested many other places those patients could have been sent, including New York City's makeshift hospital and USS Comfort military hospital ship. The state contended those facilities were not suitable for such patients.
The 9,000 patients transferred, that's 40% higher than we had previously known. It's important because these patients with COVID were sent to places that house the most vulnerable, the most frail population of the state. And indeed, in subsequent months, we now know that nearly 15,000 nursing home residents died from COVID. The question is, given the new numbers, does this cast the New York State's response to the pandemic in a negative light?
Now, when asked about the issue, Cuomo said that the state was only following federal guidelines when it tabulated the number of COVID nursing home deaths.
If we do something stupid,
the administration says, no way. We've already looked into this. The patients that were released from hospitals and sent to nursing homes were at the hospitals long enough that there was very little chance that once released, the virus was still active and could infect residents in their new homes, in these nursing homes.
Andrew Cuomo has repeatedly downplayed criticism of his administration's handling of nursing homes as a politically motivated blame game, while he also managed to write a book about his leadership, The Virus Crisis. According to reports, Cuomo's top aide has admitted hiding the state's coronavirus death toll in nursing homes out of fear of political doom. Secretary of the Governor, Melissa DeRosa, has reportedly apologized for the same. Overall, New York has lost over 45,000 people to the virus, which is more than every other state except California.